Our today's topic is the comparative study of the heart in different species and the coronary artery. First, the heart of the horse. So in case of the horse, the heart it is broader and the anterior border is more strongly convex as compared to that of the cattle. The intermediate groove which is present in case of cattle is located on the left ventricle, but in case of the horse the intermediate groove is absent. The os cordis is also absent in case of the horse, but the aortic ring contains on the right side a palate of cartilage. So what is this os cordis? The os cordis is a visceral bone that is present in the aortic ring of the heart of the cattle. The os cordis, these are two in number, right and left. The right one, it is larger and triangular in shape, and these both the right and the left visceral bones, they are present in the aortic rings in case of the cattle, but in the horse the os cordis it is absent. Now coming to the heart of the dog. The heart of the dog it is wide, it is apex, it is blunt and rounded. The two longitudinal grooves, that is the right and the left, they meet to the right of the apex. Now coming to the heart of the pig. In case of the pig, the apex of the heart it is blunt. The intermediate groove that is small or it is absent. The fossa ovalis that is present on the interauricular septum that is extensive in case of the pig, and the aortic arch it is strongly curved. Now the next one, it is the heart of the fowl. In case of the fowl, the pericardium is thin and membranous, and this pericardium it gives attachment to the falciparum ligament of the liver. As we know, the heart of the fowl it is located between the two lobes of the liver, and as a result the pericardium is attached with the falciparum ligament. Also, the right atrium is larger as compared to that of the left. In other species, the left atrium is larger as compared to right, but in case of the fowl, the right atrium is larger as compared to that of the left atrium. And there are two anterior vena cava and one posterior vena cava present in case of the fowl. The right atrioventricular orifice, which communicates between the right atrium and the right ventricle, that is not guarded by the tricuspid valve. It means that there are no cusps present and there are no chordae tendineae present. But a muscular leaf is present in the right atrioventricular orifice. The left atrioventricular orifice, which communicates the left atrium and the left ventricle, it is guarded by the two cusps, which correspond to the bicuspid valve of the mammals. Now coming to the coronary artery. Now, the heart itself it is supplied by the blood with the help of the artery. They are known as coronary artery or cardiac arteries. The coronary artery They arise from the sinuses. They are known as aortic sinuses or sinuses of Valsalva. These aortic sinuses, they are present just periphery to the semilunar cuspus of the aortic orifice. Suppose if this is aorta, this aorta is guarded by the three semilunar valves. Just periphery to the semilunar valves, there are sinuses. Three sinuses present. One is anterior and two are posterior. Among the posterior, one is right and one is left. So these are known as aortic sinuses or sinuses valsalva, which gives rise to the coronary artery. That means the coronary artery, they arises from these aortic sinuses. So anterior aortic sinus and the posterior aortic sinus. The posterior are two in number. One is right and another is left. So the left coronary artery, it arises from the aortic sinus, which is the left posterior. And when it arises, it emerges between the origin of the pulmonary artery and the blind end of the left auricular appendix. So during the course of the left coronary artery, it gives different branches. One is the septal branch, then circumflex branch, paraconal interventricular branch, the intermediate branch, the subsinusal interventricular branch. The septal branch supplies to the interventricular septum. The next branch is the paraconal branch, paraconal interventricular branch, which runs in the left longitudinal groove or in the paraconal interventricular groove. The circumflex branch, it runs in the coronary groove or in the transverse groove. The next branch is the subsinusal interventricular branch. This branch, it runs in the right longitudinal groove or in the subsinusal interventricular groove. Now coming to the next artery, that is known as right coronary artery. The right coronary artery, it is smaller than the left coronary artery in case of the cattle. The right coronary artery, it arises from the anterior aortic sinus. So when the right coronary artery arises, it passes forwards and then it goes between the pulmonary artery and the blind end of the right auricular appendix and reaches the coronary groove. Then this coronary artery, it curves around the lower border of the right atrium, and about its middle it divides into superior and the inferior branch. So here we are discussing about the right coronary artery. So right coronary artery gives superior and the inferior branch. The superior one, that continues in the coronary groove and it disappears in front of the right longitudinal groove, while as the inferior branch, it runs down on the ventricle to about its apex. So this is the transverse section of the base of the ventricle. So here this is the aortic orifice and this is the pulmonary orifice. The pulmonary orifice is guarded by three semilunar valves. They are known as pulmonary valves, which are thin and transparent, while as the aortic opening, it is guarded by three semilunar valves. They are known as aortic valves. Just periphery to these valves, there are sinuses. This is sinus 1, sinus 2 and sinus 3. They are known as aortic sinus, which we have discussed, or sinuses of Valsalva. This one is anterior, this one is the right posterior, and this one is the left posterior aortic sinus. This is the left coronary artery. So left coronary artery, it arises from the left posterior, and on reaching to the left longitudinal groove, it gives paraconal interventricular branch that runs in the left longitudinal groove. And this is the circumflex branch of the left coronary artery. So it runs in the coronary. And here this is the septal branch that supplies to the interventricular septum. And here this is the intermediate branch that runs in the intermediate groove. And when it reaches to the right longitudinal groove, it gives subsinusal interventricular branch that runs in the right longitudinal groove, or subsinusal interventricular. So this was about the left coronary artery. Now coming to the right coronary artery, it arises from this sinus, that is the anterior aortic sinus. Here it passes between the pulmonary artery, and this is the right atrium. Then it curves the lower border of the atrium, and this is the right coronary artery. So now coming to the coronary artery in case of the horses. So we have discussed about the coronary artery in case of the cattle. Now coming to the horse. Here in case of the horse, the right coronary artery is larger as compared to that of the cattle or ox. Here the right coronary artery, it goes into a right longitudinal groove, and the left coronary artery, it gives a descending branch which goes into the left longitudinal groove, and a circumflex branch which runs in the coronary groove. So first of all, the right one that runs in the right longitudinal groove, and the left coronary artery gives descending branch and the circumflex branch. Here in this diagram you can see this is the pulmonary artery, this is the left longitudinal groove, and this is the left coronary artery. So this left coronary artery, it runs in the left longitudinal groove, and this is the circumflex branch that remains in the coronary. This is the circumflex branch of the left coronary artery that remains in the coronary groove in case of the horse. Here in this diagram you can see the right coronary artery. So this is the right coronary artery, and it runs in the right longitudinal groove. So right coronary artery goes into the right, whereas the left gives a descending branch that goes into the left longitudinal groove, and a circumflex branch that runs in the coronary groove. Thank you.